Hi, this is Ann Ray, your Chinese medical doctor, and today I'm here to answer the question, why do I have fibromyalgia? So if you have fibromyalgia, that's a question you might have asked yourself, why me? Why am I suffering like this? So we're going to explore that today. So just to review, typical symptoms of fibromyalgia will include pain, usually muscle pain and often throughout the body. Difficulty with sleeping. So you may be really tired and you may fall asleep, but you don't get restful sleep. So when you wake up in the morning, you're still exhausted. And fibrofog, that cloudy, heavy feeling that you get in your head, which makes it hard to think and make decisions throughout the day. So there are other symptoms that people commonly will feel, things like dizziness, headaches, jaw pain, digestive problems, bladder problems. There are a host of other symptoms that can come along with fibromyalgia. So recent scientific literature has identified a problem with fibromyalgia patients with the autonomic nervous system. It's called dysfunction of the autonomic nervous system. So what's that? Let's unpack that a little bit. So when I think of the autonomic nervous system, I think of the word automatic. It's the part of the nervous system that works automatically without you asking it to or turning it on and off. An example of that would be the heart. Your heart beats without you even thinking about it. When you get up in the morning, you don't have to turn your heart on, right? It's beating for you automatically. The lung is the same thing. You breathe through your lungs automatically. So these are part of the autonomic, or we'll call it automatic nervous system. Now the autonomic nervous system is divided into two components, and these components are actually polar opposites of one another. The first is the sympathetic nervous system, also called the fight or flight part of the nervous system, as opposed to the parasympathetic, which is the rest and digest. In Chinese medicine, we would call these yang and yin, they're opposites. So the sympathetic nervous system is the one that prepares you for if there's danger. Say, for example, you are walking down the street and suddenly somebody jumped out with a knife and went to attack you. So your body would respond automatically for you. Your heart rate would get faster, your lungs would start breathing more, your muscles would tense for you to either attack or run away. You'd also have a surge of hormones that people will call the adrenaline rush. So you'd feel that rush of adrenaline and you'd be really strong and you'd be able to either get the person out or run away. So that's the sympathetic nervous system. The opposite of that is the parasympathetic, the rest and digest. This is the part of the nervous system that focuses on digesting food, breaking food down, absorbing nutrients, and regulating the hormonal system properly, which affects fertility, reproduction. It affects sleep. So this is the opposite. So in fibromyalgia, something happens deep in the brain that when the sympathetic nervous system is turned on, it doesn't turn off. It's permanently on. It may not be on full force as if you were being attacked. So the gas pedal may not be on full force, but it's on at least somewhat, so that your body is always revving, always going. It never stops. Muscles are constantly tight. Hormone systems are messed up. You don't get the correct sleep hormones, and you're constantly in the stress part of your life. So the nice thing is that acupuncture is an awesome way to treat fibromyalgia because we can treat it at the root. Because with acupuncture, we can actually help the body shift from the sympathetic fight or flight constant mode into the rest and digest. The change doesn't happen overnight. It can happen while you're on the treatment table, but in order for that to change to be sustained, we do need to treat you multiple times and to retrain the brain so that you can shift into the parasympathetic nervous system. And then we also will treat the pain that's associated with the muscle tightness, will help improve sleep and improve digestion and things like that. So I hope I've been able to explain to you a little bit about why you have fibromyalgia, and there is hope because we can eventually train the brain to behave. Thanks a lot, guys.